And I play with pulse width and frequency, at which point I look at this thing and I manipulate pulse width and frequency so that I'm in one of these pods. So I get the intersection. Fine, 100, we'll put them right in that box right there at 0.5. There, and then I put the patient in the correct position. I tell them what I'm going to do. I tell them how it might help them. Yes, I ask them about contraindications. Yeah, the big ones, the really big ones are on diathermy. They are pacemaker and metal. Okay? Okay? So once I get her in a nice comfortable position, not like this, I'd have her long sitting here. I would expose the body part. For instance, I might be doing her thighs, so I'd have her in shorts. I'd put the towel on the skin and this on the towel with treating the side facing down. Make sure that's nice and secure. Tell them they shouldn't feel any warmth. If they do, we'll let you know. And up we go. Go all the way to the max on this. And I'm only going for 0.5, which is that number that's in that box. Okay? Remember to do the thermal test on the skin before.
Hot and cold.
Hot and cold, yep.
Tube.
Yep. Let me get out of that. And now we're going to do ultrasound. And, oh, the other thing I was going to say, small part of the body, small treatment area, big treatment area.
What would you What would you say to, whatever you're choosing here in the hospital? Would you tell them what you're choosing and why you're choosing until the examiner?
You should act like they're a wall, a fly on the wall. Okay. Yeah. Okay. Ultrasound. Enter. Put some time on there. 10 minutes, again, is fine. I go down to frequency, and it depends on what I'm treating. Okay, I've got two choices here. I've got 1 megahertz, 3 megahertz. And 3 megahertz is for superficial tissue, like a medial collateral ligament. 1 megahertz is deeper tissue, in other words, further away from the bone, like the hamstring. Yeah. Then I can perhaps change the mode, but I don't need to change the mode. I can leave it at 1 to 4. That means 1 second on and 4 seconds off over a 5-second period. Transducer, that's just a size. Whether I use a little one for a small area or for a bigger area. And away we go. Again, thermal sensation test of the skin. Tell them about the contraindications. Tell them how this might be effective. Put this right on the skin. Tell them it's going to be cold. Yeah. Let's say you've got some on your hand. Let's say I'm going to be doing this particular area here. So I put the gel on. I begin to move it here.
And that should change to the smaller one, right?
Yeah, after I've changed it on here. I've got to change it on here. Yeah. And then I reach over here. I've got this in that position so I can have it in this position. Yeah, I'm turning the thing up and playing with it while I'm doing this. So I start the movement before I begin to turn this up. And start the treatment. There we go until the examiner tells you to quit. When the examiner tells you to quit, turn it down. Take this off, clean this, clean that. Alright?
When you're doing the ultrasound as well, do you tell them what it does while you're doing it to the patient?
You can, or you should multitask because the stuff's going to move pretty quickly on the exam. You can do that while you're doing it. Make sure you do contraindications before you start the treatment.